awards will expand. 7 of these awards will expand and strengthen mental health technology and infrastructure, including the use of telehealth. 5 relate predominantly to suicide prevention projects. 6 focus on the behavioral health needs of persons experiencing homelessness. 4 will expand access to school-based mental health and behavioral health care services. And of course, all of us over the last year to 2 years have been extremely concerned about the impact of the pandemic on K through 12 or school-age children. 4 will expand, 4 will expand to school-based mental health services. Several projects focus on underserved populations, including LGBTQ populations, seniors, veterans, Asian individuals, Latinx, and African Americans. And then there's a variety of other projects that focus on supporting our workforce, particularly frontline workers, including nurses, first responders, and primary and behavioral health care workers. We're really proud to be part of this and to help you. Our role in this at SAMHSA at large is to help you administer these grants, do our end, so that we provide the accountability that the American public expects of money that was directed to your communities for these purposes. We consider ourselves to be stewards of funding of taxpayers' money, this is a very important responsibility for us, which we take, as a privilege to be in these roles, but also we take very seriously. So those are my opening remarks. Doug, if it's all right, then I think at this point I'll turn it over to Doug Slothaber, who is the branch chief in the branch where the majority of these grants reside. Doug?
Thanks. Thank you very much, Dr. Everett. First, I want to say thank you for everyone for joining us today. We know that this has been sort of a quick turnaround, but these are sort of an unusual grant program for us. So on the call today, we have Leslie Schreier, who is the Grants Management Specialist for the Division of Grants Management, who's going to speak and really cover most of the material today regarding sort of the financial responsibilities and grant responsibilities. As Dr. Everett said, I'm the branch chief where these grants are residing. And also with us on the call today is Tara Andrews, who is the coordinator for this program and who's going to be tracking the progress and the work of the GPOs with each of you. So a couple housekeeping things. This is being recorded, so if you object to that, you can drop out now. Also, there's way too many people on this call to have people kind of chiming in. So everyone, please stay muted. And if you have a question, please post it in the chat and we will try and address those as time allows. I also want to preview for people now that this is not the only kind of support we'll provide. Next week at this same time, we will be offering essentially an office hour to answer any questions that the people might want to dial in with, specific questions related to, kind of addressing the terms and conditions or other needs of their grant to kind of get through this process. But that's essentially kind of what we're doing for today. So Tara, if we can go to the agenda. Yeah, so I'm not going to read through all of this, but as I said, we're going to talk through all of the expectations and requirements for this grant today. And Leslie will cover most of that, but I just wanted to talk briefly about sort of the background of this program. So we can go to the next slide. So, as everyone knows, these particular projects were authorized in the Consolidated Appropriations Act of 2022. So each of these is essentially has its own individual authorization, which is unusual compared to most of our grant programs. SAMHSA sees the purpose of this program is to effectively administer the mental health related, in this center, the mental health related non-competitive grants designated in the Consolidated Appropriation Act. Unlike a typical discretionary grant program, the specific goal of each program is defined in the language of the statute as well as in the application you submitted, insofar as it aligns with the statutory language. So, what that means is at the end of the year, you're going to be submitting a report on the accomplishments and the outcomes of your program. And, that is going to be measured against what you said in your application that the intent and goals of your program are, which needs to, of course, align with what was said in the Consolidated Appropriations Act when it authorized spending the funds on this program. So that's just sort of like the most important thing, is to make sure that the activities that you pursue with these funds align with what is said in the application and what is said in the congressional language. Next slide. So SAMHSA's goal is to ensure progress on these grants while minimizing risks to federal funds. So at SAMHSA, we work as a team. There are grants, government project officers, grants management specialists, and the GMO are all SAMHSA personnel who work together as a team. And it's highly recommended that anytime you reach out with a question, you copy both the GMS and the GPO on your emails. Next slide. And within that, the government program official or government project officer, the GPO, their name is on your notice of award under contacts and is responsible for the programmatic aspects of the grant. We work in partnership with the grants management staff. So anytime you have a programmatic question about your program, reach out to your GPO. If you have any issues with responsiveness or not sure who your GPO is, you can reach out to Tara Andrews. And just kind of foreshadow what's coming up next. Your GPOs are going to be working with you specifically to make sure that your project director is approved and approval of the program's participant protection plan. The needs of those will vary because, as Dr. Everett laid out, there's a lot of different things being done with these funding by different programs. So, the needs of the PPP will vary according to that, but they all need to have some form of participant protection plan that is reviewed and approved. And so those are the things your GPO are going to be reaching out to you very soon. So with that said, I'll just say that again, we'll be available next week during an office hour, and we're available by email for questions. So I'll now hand it over to Leslie to carry out the balance of this presentation.
Thank you, Doug. So I'm Leslie Schreier, and I'm the grants management specialist for all of the CDS awards this year. And as the grants management specialist, I oversee all the financial and administrative aspects of the grant in combination with your program officer. So as Doug said, please always copy both myself and your GPO on every correspondence, because sometimes the financial and the programmatic issues are blended together, and we will definitely respond to you from the point of view that is most appropriate. In addition, I just want to use this time to state that when you do email us or leave a voicemail, please identify your grant number in that message or on the subject line. And your grant number will start with FG00, and then it will be 3 digits. You might see 1H79 FG. We just need the FG00 and then the 3 digits, and that will be very helpful for us to pull up your award immediately. I'm going to stop showing my video as I speak so I can see the screen as well, since I'm down to like 1 screen now. All right, so let's go to the next slide where it talks about the roles and responsibilities. So on the SAMHSA side, we just discussed the roles and responsibilities of the program officer, which is your GPO, and the grants management specialist, which is the GMS. On your side, the recipient or the grantee side, you have basically 2 positions that we need to always know about and who holds that position. One is called the authorized official or the business official. And where you have communicated that position to us is in your application on the form called the SF424 face page. In section 4, you should have included the ERA comments of the project director. In section 8, it should have been the name of the project director and their email and their address. And then finally in section 21 is where the authorized or business official contact information should be. And this slide talks about what the business official is responsible for. Ultimately, they are the official point of contact for the award. And when SAMHSA sends an automatic email through ERA, both the project director and the business official listed on that face page, the 424, are the individuals that receive our emails. Now, if your GPO is just responding just to you, not through an automatic email in ERA, obviously, if you have asked them to copy other individuals, hopefully they will be able to honor that. But if it just goes through ERA, it's only 2 emails that get notified. Just letting you know, because I've already received many emails from the recipients of the CDS awards. Oh, please add this person, please add this person. And it's not an option in ERA. All right, let's go to the next slide. And the next slide talks about the project director. So in ERA, it's called the PI, the principal investigator. SAMHSA calls it the PD. So we're going to refer to it as the PDPI. You should know that your PDPI should not be the same as your business or authorized official as listed on the SF424. The PDPI is the primary person responsible for the day-to-day operations of the grant. So you might want to revisit who you selected and make sure you have identified the right person. I do want to bring up one issue that has already come up. A lot of the GPOs from SAMHSA have already reached out to the recipients and they said, oh, please just let me know who the project director is and the correct email. That's wonderful. However, I need to let you know when you read your notice of award, on page 1, there's a cover sheet and it will say project director on the left-hand side. That is not necessarily the project director because that was generated through ERA, and whomever you used as the ERA Commons ID, because you happen to have one ready to go and up and running and the turnaround was so quick, we realized you used that ERA Commons ID, that's who would assign the PDPI role. However, if you read further into your notice of award, I think it's around page 3, there's a subheading called Key Personnel. That is the project director that you identified in your full budget. And it lists the name and the level of effort. If that person on page 3 is not the correct project director, you will need to submit a post-award amendment key personnel change, which I'll talk about in a little while. But I just want to let you know there were many submissions in one application that had different information. So the ERA Commons ID and section 8 on the 424 should be the same individual listed in your full budget as the project director. If those 3 individuals did not reflect the same person, when I issued the award, I had to pick somebody and I identified that person on page 3. So we might need to revisit who the official project director is, but it's not a problem. We will get through it together and we will resolve any discrepancies. Let's go to the next slide, please. The next slide just shows you an overview of the grant life cycle. So we don't talk about the pre-award phase at this point because that was just the notice of funding, which has already been published and you responded to. The award phase just happened. We made decisions about the awards and we issued the notice of award, which you are all in receipt of now. We are now in the post-award phase, which is implementing, getting started, making changes if as needed, reporting, and ultimately closeout. It's very premature to talk about closeout. However, this grant is only a 1-year grant. It potentially could go into a 2nd year as a no-cost extension. We will not get into that until about 3 months before the end of this project period. So it's premature to talk about closeout, but that is considered the post-award phase. Let's go to the next slide. Okay, if you happen to have your notice of award in front of you, that's fine. If you don't have your notice of award in front of you, that's fine too. I'm just going to talk about the highlights of it. First of all, the notice of award is the only official legal binding document. It will notify you of your award amount. It contains references to all the terms and conditions, any funding limitations. It contains special terms and conditions and due dates that you must read. It contains reporting requirements and due dates. And it's very important to read the entire thing. I've received a few emails and calls. People are asking, where do we sign? How do we officially accept this award? And on page, after the cover page, so I guess it's page 2, there's a statement on the notice of award, and it just says, acceptance of this award, including terms and conditions, is acknowledged by the grantee when funds are drawn down or otherwise obtained from the grant payment system. So in other words, there's no form that you have to sign. It's just the first time you draw down funds, you have accepted the award. Okay, let's continue along and talk the next slide. On page 2 of your notice of award, it'll show budget period and project period. Since this is only a 12-month grant, the budget period and the project period are the same. The budget period started 9/30/2022, and it will end 9/29/2023. Sometimes I get questions and recipients say, oh, does the start of my award start when we actually, draw down the first funds? No, that's just the acceptance of the award, but the budget and project period actually started 9/30/2022. Let's go to the next slide. The next slide just reiterates what I just described about acceptance and the terms. So we can move on to drawing down funds. So I've gotten a lot of questions already about setting up payment management. How do you access your money? Is my money there? So the answer is yes. As of 9/30/2022, the entire award has been deposited in your account. Please follow the links and the steps on this page. And I'm pretty sure we're going to send the slides out after about how to access your payment management account, what you need to do as a new user to set up your account. And you should know that you should only draw down funds on an as needed basis. So don't go into the system and say, wow, here's my $1 million, here's my $100,000, and draw it down, and it should not sit in your organization's account. It stays in payment management, and as you need it, you make drawdown requests. And once that money is in your account, the expectation is for it to be spent within 3 business days. If it's not going to be spent within 3 business days, you should deposit it back in the payment management account. I can help with payment management only slightly. It is a separate function and organization, and you actually have a payment management representative. If you go to the payment management website, which is listed on this slide on the last bullet, it says to find your payment management liaison accountant. It will ask you a couple of questions. Are you a nonprofit? What state are you from? As long as you click from the drop-down menus and then hit enter, you will be brought to a screen that shows the payment management rep name, email, and phone number. And all specific questions to payment management are best directed to that person. You'll also see, I think there is a backup person listed on that screen too. So you'll have 2 names and numbers that you can reach out to with payment management questions. If you have trouble drawing down money from payment management, you can reach out to me. It could be as simple as when the application was submitted for the award, it might have been the wrong EIN number. So there are reasons to contact me, your GMS, to discuss payment management, but I might wind up sending you to your payment management rep for more specific questions. Okay, we go down to the next slide. These are a list of some of the special conditions that you may or may not see on your particular notice of award. Not everyone had the same concerns. However, I believe all of the responses are due back within 30 days, which is why you see the due date of October 30th, 2022. And responses to special conditions with a due date are also known as tracked terms. And in ERA, you will need to upload a PDF of whatever document was requested of you in tracked terms. I will talk about and show you later where to find information on how to upload to tracked terms. And but some of the types of special conditions you might see are we're requesting a revised detailed budget with narrative, because maybe when you submitted the application, the budget was missing or not didn't have a full description. And so this is another opportunity to present that. Some of you may have charged indirect costs, but didn't submit a copy of your indirect cost rate. So that is a possible special condition. Some of you may have identified the project director, but didn't give their resume or didn't supply the position description. So that's a possible term. If you were charging rent for delivery of programmatic services, not organizational rent, we might need additional rent documentation. Those are grants management types of special conditions. There are also programmatic conditions. There's something called programmatic concerns. If the GPO who read your application felt that there was additional need for more information, they put a programmatic concern as a special condition. There are also participant protection concerns, and those are some of the initial things that your GPO is going to be working with you to address. But like I said, please read the entire notice of award. Everyone gets the award, gets very excited, sees the dollar amount, and they're off and running. But there are conditions that have to be removed before you can actually spend your money. One of those conditions, if you have a participant protection concern, when you read the narrative that goes with it, it says you may not draw down funds that have to do with participant protection concerns. So those specific funds that have to deal with people are not available to you right now. If you have to give us rent documentation, you can draw down funds to hire your personnel and your fringe and travel, but you can't spend the money on rent until the rent condition is removed. If you have any questions about when you can draw down money or not, just give me a call and we can go through your specific notice of award. Okay, let's go to the next slide. The next slide is how to respond to special terms. So as I said, it has to be submitted in the ERA terms tracker. And this hyperlink to training materials is a very, very useful hyperlink. It'll bring you to the SAMHSA website, all of our training materials. And if you read down the page, there'll be in bold, how to respond to a tracked term. And there'll be a video, there'll be a one-sheet reference sheet if that's easier for you to follow, and it'll help you upload your information. Okay, we can go to the next page. Post-award amendment. So that is exactly what the title says. It's after the award. So any changes that your organization wants to make could be a budget change, a key personnel change. We'll list them out on the next page, which we're not up to yet. It's called a post-award amendment change. So you're going to become very comfortable with submitting two different types of responses in ERA. Previously, we talked about a response to a tracked term. Those were conditions on your award submitted to tracked terms. That's, we asked you for something. A post-award amendment is your organization is asking SAMHSA for something. You want our approval to do a certain action, post-award amendment. Let's go to the next screen. They'll itemize some types of post-award amendments. One of the biggest post-award amendments is significant rebudgeting. So you take your award amount, you multiply it by 25%. You as the recipient are allowed to move funds from one approved line item to another approved line item if it's less than 25% of the total award or $250,000, whichever is less. So if you were someone who got $4 million, right, 25% is $1 million, but you can't move $1 million because it reached the threshold of $250,000. As soon as you hit $250,000, that is a budget revision that has to receive prior approval. Other reasons you can't move money into equipment without prior approval. You can't move money from a line item that was approved to a new line item without prior approval. So if you had money in personnel, fringe, and travel, and now you're saying, I want to move, it's only $10,000, but I want to move it to other or contracts, and you didn't have money in that section before, you have to submit a change in scope. Change in scope is moving money to a new third-party contract. So the second bullet says transfer of substantive programmatic work to a contractor. Anytime you're adding a contract, you need prior approval, change of scope. The third bullet is a change of staff. The only key staff on this grant is the project director. So if you're changing your project director, that's a post-award amendment key personnel change. I would suggest you go to the SAMHSA website, very easy, www.samhsa.gov. Once you get to our main page, across the top bar, there'll be a tab that says grants. Select grants. Once you're there, in the middle of the page, there'll be a hyperlink that says post-award amendments. And then they'll list all the different types. Whichever type you're trying to do, you'll click on it and you'll be prompted with the types of documents that you're going to need to submit. So you'll be aware that for a key staff change, you have to submit a cover letter. You have to submit a resume. You have to submit the position description. So it's not guesswork. It's all on the website, but it's no problem. If you need assistance, you can always contact me and I will send you the links and the documents that you need to work on. So I listed some other types of post-award amendments. The only one listed here that you'll never need is a carryover amendment because it's only 1 year and you're either going to end your grant within that end of 12-month period, or you're going to ask for a no-cost extension. So you're not having any carryovers. So don't worry about that. Okay, we can move to the next slide. In the FFR, under reporting, there are 2 reports that are going to be due for this grant. And one is called the FFR, the Federal Financial Report. And typically that is due on an annual basis. And it is due 90 days after the close of the project period if it's an annual FFR, and it's due 120 days after the end of the project. So right now, everyone's project is ending in 1 year. So if you don't get a no-cost extension, you'll have 120 days after the end of the project to submit the FFR. If you wind up coming in for a no-cost extension, then you had 90 days after the original project period to submit that annual FFR. And then when the no-cost extension ends, you'll have 120 days after that to submit the final FFR. Okay, let's move to the next slide. And that's the second type of report that will be due. That's the programmatic progress report. It too is due on an annual basis following the 90 and 120 day time periods, just like I discussed with the FFR. And as we are approaching the end of the annual, the 12 months, your GPO will reach out to you and provide a template of what type of information they're going to need on that report. So the programmatic report gets uploaded to tracked terms, and the FFR gets submitted in payment management. You don't have to remember that. you'll receive emails and notifications and reminders from us about that. Okay, let's move to the next slide. The next slide has some grant management tips. So all requests come through ERA, please. In the past, recipients, they try to email us information or requests, and it's not official unless it comes through ERA. If you want to run something by your GMS or your GPO, of course, submit it as a regular email. Use ERA two-way correspondence. ERA two-way correspondence automatically puts a copy of any email into the grant folder, so it's documented. But if you say, oh, I'm thinking about moving money from here to here, what do you think? Is that allowable? Are these costs allowable? You can send that through correspondence. We'll reply to you, and then you can submit the actual budget request through ERA as a post-award amendment. About budgets, we really highly recommend that you submit any budgets or budget changes using the suggested budget template that this link will bring you to. You can submit a budget any way you'd like, but this is suggested as it really prompts you to provide maximum details, and it makes our review much more simple, and we can get back to you much more quickly. Anytime you submit a revised budget, please submit your approved indirect cost rate agreement. So it's together with your request, and we don't have to look back in the grant folder to see, have they ever submitted one? We just have the current one. There is a user guide available for this sample budget narrative and justification. And if you have to submit a revised SF424 face page or SF424A it's a budget, I think it's called budget non-construction chart. You can find them on grants.gov, or you can follow this link and download the templates. So that will make life a lot easier for you. Okay, we can move to the next slide. The next slide is just a gentle reminder, which is not so gentle, to include your grant number in the subject line. And when you're communicating with us, to include your name, position, org name, and your contact information. If you are a grant manager, but not the project director, but you're working on behalf of the project director, in order for us to be able to communicate with you, please copy the project director and the authorized official on all your emails, so we know that you have authority to ask the questions you're asking. Otherwise, we're going to write back to you and say, we can only communicate with official named people on the grant. It's for your safety. It's not because we're just being obnoxious. It's just we're protecting your privacy as well. Okay, we can go to the ERA service desk slide. And I'm sorry to say, from time to time, you're probably going to run into some snafus with ERA. You'll see a warning, an error message, it's not working. I am not an ERA expert. I do not see what the recipient sees, your view in ERA. I can only see the SAMHSA side. So you might reach out to me and perhaps I'll be able to assist based on a screenshot of an error message that you have. But I would highly recommend you contacting the ERA help desk with basically almost any error or warning, because they are the experts. And here is the contact information, how to reach them by email or toll-free number, and their hours. And finally, there's another page with many, many resources that you might find useful. It has payment management resources, ERA resources. It even has SAMHSA grants management resources. You'll see post-award changes, training links, and a list of financial management requirements. The 2 CFR Part 200 is the general requirements for federal awards, and 45 CFR Part 75 is SAMHSA specific cost principles. The HHS policy statement is listed there. All of these might prove useful if you have a question. Again, I guess I didn't put it on this list. I think your first line of defense if you're have a question, confusion, or just need to have some guidance is the SAMHSA website. It is, once you get used to navigating it, it is very easy to use. It could be overwhelming, so do feel free to reach out to me. I will help you. But the SAMHSA website does have an awful lot of information that can help you navigate your way through this process. And finally, on this last slide, you have Tara's, email address and my own email address, leslie.schreier@samhsa.hhs.gov. Feel free to reach out to both of us. And when you read your notice of award, on the last page, the bottom of the last page, under contacts, will list your program officer and my name as your GMS. So I know it was an awful lot of information. I'm open to taking questions now. I'm open to receiving emails later. And I'm pretty good at responding to all emails. And I do take calls, but if you do email me in advance, then I can be prepared to address your issue when we do set up a call. So I would prefer email, but whatever works for you will work for me. Okay, Doug, that's what I have. I'm gonna take myself off of put my camera back on so I can see everybody here we go. Okay.
Thanks very much, Leslie. That was great.
All right. I hope I didn't speak too quickly, but you're going to get the slide deck. And all right, I see the chat has a lot of things in it. Maybe there were questions in there. I don't know.
Yeah, there were some questions in there. Hopefully a number of them got answered during the course of your presentation, but we can go through some of these.
Okay, let's go back in time. I'm going back to the beginning. Can you have more than one business official? So officially, no. We only take one business official name, but in ERA, you can assign more than one person the AO role. But there's one business official for SAMHSA, one email. All right. Can the BO be the project director too? It is advisable not to have the project director and the BO the same person. We used to be very clear. There used to be very clear division between the BO and the project director, and now we are leaving it to the recipient to make that judgment call. But if you only have the business officials responsible for the grant, ultimately they shouldn't also be the project director. It's a possible conflict of interest there. So that is something that would, an auditor would be interested in seeing that. And you will only get one email notification then, or you'll actually get two email notifications to the same individual. So it's better to spread out that power, I guess. All right, next question I saw in questions. Will you let the grantee know if they need to address special conditions? You already know because you've received your notice of award. And in your notice of award, there is a section that says special terms and conditions, and they have due dates. So the only time I'm going to let you know is if it's delinquent. Once you miss that due date, you're going to get an automated email through ERA saying that you're late. Don't panic. We're not going to restrict any funds because you're a week or 2 weeks or 3 weeks late, but you will get an email notification that it's late, and potentially you could get a call from your GPO if it's a programmatic term that needs to be resolved right away for you to start your award. Okay, attachment 6, appendix C indicates that confidentiality participant protection is required if applicable. Since we are not providing direct client services, given the wording of the terms, I would think we could only submit an explanation if this was omitted. If you have the participant protection concern on your notice of award, the program officer who reviewed that application disagrees with you and thinks there are potential programmatic concerns, participant protection concerns. So either call or email your GPO and ask what they needed from you, or read the notice of award and perhaps there was a specific document that was missing from the application. But it's definitely a programmatic term. And if it was added somebody thought something needed to be addressed. It's not me. I'm the financial person. I'm just the keeper of all the terms, but program will evaluate your responses to most of these things. Yes, everyone will receive a copy of the slide deck. How do we find our username and password for the PMS system? You need to go to PMS, the website, and go to user guidance and follow that guidance. Okay, somebody put that in. Click request access. Okay. We can make whatever changes to our budget as it is a track term, but after we submit the track term, the post-award requirements apply. What if we are making these changes then when submitting track terms? If you were asked to submit a revised budget, then you can submit a revised budget and make any budget changes you want to make. And when we ask for a revised budget, we review it as if we have never seen your budget. Everything goes back to zero, and we review every single thing you ask for again. So we're not just reviewing the minor change. If you submit a revised budget, we review it in its entirety. If you have an approved budget and you weren't asked for a revised budget, but you want to make a change, you're not submitting it in track terms. It's being submitted as a post-award amendment. If we are asked for updated PD in the award, do we also need to submit the amendment? Okay, if you were asked for confirmation of your project director and you see that that project director is not correct, or somehow we picked the wrong one from the many names you submitted, you do need to submit a post-award amendment to change the project director. And once we review that and approve that, I will go back into track terms and close that term out, so it's not going to reside there anymore. Any changes to the project director must come in as a post-award amendment, because when something comes in as a post-award amendment, the GMS, myself, and the GPO review it, have to answer questions about it, and both of us have to approve it before we issue a revised notice of award. So that's why the process is the way it is. Can we get the template now so we can ensure, I'm guessing for the programmatic report. I'm gonna give that to Doug and see if his team of GPOs will have that template available and when.
We'll provide that template within 30 days. I would just say that, in general, the template, the final report is programmatic report is going to, as I said earlier, it's going to be asking about your progress and your outcomes on the goals identified in your application. So, if you're providing services to individuals, you want to be tracking, the number and the types of services provided. But we will provide the complete template with all those expectations within 30 days.
Thank you, Doug. I see another question about data collection, and it asks, are there any data collection requirements for this grant? So obviously there'll be some data because there's going to be a template to report on, but specifically there are no GIPRA data collection requirements for this grant, if that is what this was asking about. Okay, the PowerPoint will be available. So someone asks, how does fund encumbrance to a contract work in relation to drawing down funds? Should we encumber all funds or draw down? You have to draw down as you use the funds, so you don't take the entire amount. We should send a revised SF424 to update the business official via track terms. So if you had a tracked term requirement to submit an SF424, that does get submitted in tracked terms. If you were not asked for a revised 424, but you see that the business official is not the current business official for whatever reason, if you have other conditions that need to be resolved, you can submit the 424 with that, and I will update it when I issue the revised NOA. If you have no other terms that needed to be addressed, you are good to go from the start, but you need to change the business official, please contact me, because there is a way for the recipient to request of the ERA help desk how to change just the business official should a notice of award not need to be issued. In other words, we're not going to issue a notice of award simply to change the business official. You can do that from your end, and ERA would help you go through that process. If our original app showed our org as directly providing service and we have decided to contract instead, will we need to ask for a post-award amendment? Definitely. If you are going from your organization being the primary recipient and providing the services, but instead you're going to be a pass-through and have it all contractual, that would be a post-award amendment change of scope. If terms and conditions have to be accepted by 10:30, no place does it say that. And we accept the standard terms and conditions by drawing down funds. Does that mean our drawdown has to happen by 10:30? So there is no expectation that you have to accept terms and conditions by 10:30. 10:30 is the date you have to submit any revisions. Until you get a revised notice of award, they haven't been accepted or not accepted. But you can draw down funds if your terms and conditions don't have anything to do with restrictions on budget. You can always draw down funds for personnel to get the grant up and running, even if you don't have a revised budget. So there is some flexibility. What does confidentiality participant protection mean? Can you give us an example? Doug, I'll give that one to you.
Sure. So anytime you are working with individuals, you need to provide adequate confidentiality and security for their personally identifiable information, PII. And so in your participant protection plan, you're going to need to clearly state, how that's provided, who has access to the information, what type of information is being collected, how is the data being stored, how are the individuals who are served notified about their rights around confidentiality of their information. There's a lot of details with it. And because this is such an unusual grant, it's going to vary on a case-by-case basis. So this is something that you can work with your GPO on the specifics of. If you have this on your NOA, please talk with your GPO and they can provide you more specific details to your project.
Thank you, Doug. Next question, the grant we were awarded is 100% pass-through to a fully licensed and accredited behavioral health provider. Can the program director be an employee of the subcontracting organization, or must they be an employee of the applicant organization? So you actually can have a project director that is associated with the subcontractor. However, you're required to submit a letter stating the role of that subcontractor PD and that they are informed about reporting requirements. If that is something that you're interested in as an organization, please email me the specific question and I can email you back what you would need to provide if that change is going to happen, okay? Is a disparity impact statement required for these awards? The answer is no. Is there a template for participant protection concerns? I think you can go back to the original NOFO and look at the different attachments. And if the participant protection concern that was placed on your award, it should say attachment 6, attachment 2, and then you can see what the questions or templates should be. You mentioned for SAMHSA, the PD and the PI are considered the same role. So there cannot be a different PD and PI. Actually, in your organization, you can have a PD and a PI, but ultimately in ERA, you have to assign one of them the PD PI role. So whomever you want to be overseeing the day-to-day operations of your grant, and you want them to receive the email from us, that's who you're going to put in the system as the PD PI. But on your personnel, you can have a separate PI. Would the program progress report request demographic information of participants? That's a program question. Doug, do you know offhand if it's going to ask for that kind of information, demographics?
Yeah, we'll provide clarity on that when we send everyone the template.
Okay, once the confidentiality participant protection condition is cleared, can we use funds that are currently not able to be used from the start date of the grant or only from the date of the condition is cleared? No, once your participant protection is cleared and all conditions are removed from your award, all the funds that were available to you day one are available to you. Relative to funds drawn down and the must expense use the funds within 5 business days, can we draw down on a monthly basis to reimburse prior month's paid expenses charged to our earmark? Last month of budget period, how do we reimburse the last few weeks of expenses? Okay, so you are not supposed to draw down 1 month at a time. It's supposed to be as you're using the funds. That is the optimal way. If you happen to do it a different way, I'm not going to go into the system and look and see that. Perhaps if you were audited, it might be a question that you were asked. The recommendation is to use the funds within 3 to 5 days of drawing it down. And the last month, typically, you know what your budget is, and you're at the end, you're just paying. You could list something unliquidated obligations on the FFR. In other words, if you entered into the contract, you received the services, but you haven't received the bill for it yet. How do you pay that if the grant is ending? You report it on your FFR that's due 90 days after the close of the project period as an unliquidated obligation. But I did say when it's your final FFR, you actually have 120 days to submit the final. So that gives you an extra 30 calendar days to resolve any costs that you still need to pay out. And you can revise your FFR, and the unliquidated obligation, once you pay it, becomes an actual federal expenditure. Or if it's determined that's not going to be a cost, then it would move to unobligated. So I'm sure your financial staff is familiar with those terms and would be happy to chat with them if they have any questions. If we are changing a subcontract organization, do we have to submit a post-award amendment? They are doing the same job as the old subcontract, just a change of organization providing the work. Yes. If it's a new third party, we still need a change in scope, just so the grant folder is up to date and we know where the funds are going. I have a confidentiality participant protection concern, but no reference to where we missed this in the NOFO. I think it's Appendix C. I would suggest you reach out to your program officer via email and ask them specifically what they were looking for if the notice of award was not specific enough for you to resolve this. Can you pay for budget items with internal funds and then draw down funds retrospectively? You are not supposed to do that. If you have funds that you can pay, you aren't supposed to ask for the grant, because the grant, if you have funds and then use federal funds, it's called supplanting, and supplanting is not allowed. So, and you have to be sure to keep your funding stream separate. So I would go with no on that answer. I made it through all the questions that were in the chat. I know we were supposed to end at 3:30. I can stay for a little while longer. If anyone has any questions they want to share, please unmute yourself and we will try to address those. If nobody has any questions.
I have a question.
Oh, someone has a question. Yes.
Okay. So if you've had a lot of federal money before and you go into that ERA again and it lists you as the PI, right? Okay, but you have to sign in as the PI, whatever ERA Commons thinks you are, you have to go, you're telling us we have to go and identify who the project director is in ERA Commons, correct?
I'm saying that I need to know who the official project director is for this grant. And if that is not the person on the NOA, if the, not page 1, but page 3, under key personnel, it should say key personnel, project director. And if it says to be determined, project director at to be determined level of effort, I need a post-award amendment. If there is a name in that section
Yeah.
and it is correct,
Yeah.
and it matches the project director listed on page 1, meaning you had the correct ERA Commons ID on your 424, those two names match, you're good to go.
Good to go. Okay. Last question is about the award number. You said just start with FG and then
Yes.
zeros here. but
Okay,
you
so on page 2, let me close this
said
1
page
second.
1.
I have one on my screen. So, okay, we can look on page 1, the blue and white page. On the right-hand column, number 11, it says award number. It starts with 1879 FG 000 and then 3 digits. So when you speak with me or email me, you could copy the whole thing if that's easiest, or I'm only looking at FG and then I'm looking at the last 3 digits, 800, 801, 750, whatever your number is.
What if you have a -01 after that? Do you need
Yes,
that?
-01 means you're in the first year of the award. So you're only going to have an 01 because you're only 1-year award. So other grants that are 5-year awards, it could say 04. And then that means that's the 4th year we awarded them money for that grant. So the 01 is your budget year.
Thank you.
So-
And I just want to say to the SAMHSA administration, you guys have made this as painless as possible. And thank you, Leslie and Tara, because I've had earmarks before, 12 years ago. We didn't have this much paperwork. So thank you for all your help. Appreciate it.
Okay, I'm sorry. It's SAMHSA policies and HHS policies. And but if there are any questions, please reach out to me. I will make sure I get you an answer if I don't have the answer.
Okay, we're fine here.
Anybody else who wants to speak as a group? And if not, I'm leaving today, so don't call me today, but tomorrow I log on. My hours are 7 a.m. Eastern Standard Time to 3:30 p.m. Eastern Standard Time. So you can call tonight or email tonight and I'll see you first thing in the morning, okay?
Thank you.
Thank you all.
Okay, all
Bye-bye.
right, Doug, do you have anything? We're done?
No, thank you all.
Okay, thank you.
Thank you.
Let's do it.
Yeah.
Doug, will you be able to send the PowerPoint out to this group?
Yes, everyone will
Okay.
receive a copy of the slides.
Okay, wonderful. All right, I'll talk to you tomorrow.